The last year has been like nothing else I've experienced in all my years of nursing. It's been hectic, extremely stressful, physically, mentally grueling.
When COVID hit, like any other crises, nurses in this country ran into the hospitals when everybody else was harboring at home and trying to figure out how to stay safe. Nurses proudly, and I would say almost instinctively, ran to help.
Nurses are tired. Nurses gave their all in a year where we didn't feel like there was any other option, and we were giving our all before that.
Of local nurses go on strike this morning.
Happening right now, hospital workers are on strike in Wyoming County.
Registered nurses at Barton Memorial Hospital in South Lake Tahoe went on strike today.
All the nurses behind me is staff. They want staff and PPE. PPE that they are not told to reuse.
Our particular hospital made over $250 million over the course of the last 5 years. And then you add the things that the federal government was doing to support them. And rather than turning right around and putting that into frontline staff in a meaningful way, we haven't seen any of that.
At the end of my shift, I would be mopping the floor, taking out the trash.
We were short on respiratory therapists, we were short on nurses.
So when you're mentally drained, you don't make good decisions or the right decisions, and you're more apt to make mistakes. And when a nurse makes a mistake, it could mean the life or death of a patient. So it's a safety issue.
And I was working weekends and nights, and so I'd come in for 12s. Sometimes I would extend to 16 hours if necessary.
And it's been morally distressful for all staff when they feel like they've been working so extremely hard under conditions where they can't take breaks, where they can't really eat a full meal, or they're shoveling food down very quickly, and they leave work feeling that they didn't give the quality care that they know our patients deserve.
As most nurses, they seem, to care about others way more than they care about themselves.
The company that owns St. Vincent Hospital in Worcester has hired 100 replacement nurses. That comes just days after striking nurses rejected what Dallas-based Tenet Healthcare called its last, best, and final contract offer. Tomorrow marks the 155th day of the walkout, with the striking nurses insisting that Tenet's contract proposal still understaffs the hospital. Even a federal mediator hasn't been able to bridge a deal.
We're using all of our resources, and finally people are coming together and using their union to make themselves stronger. I mean, that's what the union is for.
When it comes down to, fighting over earn time or wages or safe staffing levels, we're going to dig our heels in this year. What else have we got to lose?
Well, I think all workers want to be respected, and in times of a pandemic want to be protected. And I think at all times workers want to be paid a fair wage. So I think what nurses and all working people have in common is respect us, protect us, and pay us.